Each weekend, ABC 10's Walt Gray catches up with a CalMatters journalist about the biggest political stories of the week. So if you're not caught up with the latest on California's gas tax and the single-payer health care proposal, well, here's what you need to know.
Welcome to our weekly discussion of all things current in California politics. I'm Walt Gray. Joining us this week, reporter Emily Hoeven, political expert for CalMatters.org. Emily, good to see you. AB 1638, Kevin Kiley, Republican assemblyman, has put this in play, which would do away with the excise tax on gas for 6 months. Now, how do you think that's going to play with getting that through a Democratic legislature?
I don't think it's going to play too well, especially given the fact that the governor has also proposed in his recent budget proposal to basically give Californians what he's calling a $523 million gas tax holiday by basically suspending this gas tax increase that was going to go into effect in July. And so although Assemblyman Kiley says his proposal would go further and give Californians more of a tax break, I don't think you're going to see Democrats endorse that, especially when the governor has already put out his own proposal.
Okay, I didn't think so. Okay, single-payer health care is also being proposed by Democrats. How is that going to work, and what will happen to people's own health insurance?
Well, that, interestingly, is kind of facing the same conundrum as Assemblymember Kiley's bill, in that the governor also has his own healthcare proposal that actually does not go as far as this Democratic proposal to create single-payer healthcare. The governor wants to basically extend Medi-Cal, the state's healthcare insurance for low-income people, to the one remaining block of undocumented immigrants that currently don't have access between the ages of 26 and 50. And, he's kind of gone out and said, how are we going to pay? He's more or less said, my plan is funded, my plan would not raise taxes, which kind of implies that the single payer proposal is neither of those things. It doesn't appear that the single payer bill, might have necessary momentum to actually go through and become law. And for it to actually affect Californians, it would have to be approved by voters. And we'd also have to get federal waivers from the federal government. So this is going to probably be a long process that, may not necessarily come into fruition this year.
Yeah, we expect a long process on that. California healthcare workers, are they supposed to be going to work due to a shortage of workers, even if they have COVID, if they're asymptomatic? This is another hot button one.
Yeah, it is. I mean, so the state's healthcare worker shortage is so dire. The state Department of Public Health recently gave hospitals the option to allow COVID positive asymptomatic workers to keep working without quarantine, without isolation, without further testing, as long as they have kind of proved that they are so low on employees that they need this to happen. We're seeing a lot of pushback from healthcare workers. The California Nurses Association was holding rallies all across the state this week to basically say you're putting us at risk and you're putting patients at risk. So it's another hot button topic, as you said.
Yeah, there's a lot of battles going on. All right. Emily, thank you. CalMatters is a nonpartisan news organization explaining California policies and politics. Find their work at CalMatters.org. You can also sign up for Emily's newsletter there.